Hey team, today we're going to go over 3 exercises, very basic exercises that are typically used after shoulder surgery. So anything from a rotator cuff repair to a labral repair to some type of shoulder stretching that might occur, such as after a frozen shoulder, manipulation under anesthesia. So there's multiple surgeries that might be performed, but these are usually the 3 best exercises to get started. Obviously, every situation is different, and your situation may be different, so make sure you go with the guidance given from your surgeon and your physical therapist. But these are 3 easy ways to start improving mobility to the shoulder after surgery. Now the key is with a lot of these, you don't want any active mobility to the shoulder itself. So we don't want the muscle to fire. So anything that you do that causes the muscle to fire, it's probably going to hurt. It's probably going to be pretty sore. So one of the ways to do that is make sure you use the opposite arm to lift it up onto a table, up onto any type of surface to hold it there. And by helping it, it's not going to fire the muscle and it's not going to shoot in pain. None of these should cause shooting pain. If you're getting shooting pain, it means that you're trying to assist using the shoulder, particularly after a rotator cuff repair, and it's going to have this sharp, sharp pain. So what we want to prevent is any of that sharp pain. This should just be a dull, achy stretch that you should get. So the first one we're going to start is on a table or surface like so, and you're going to assist the arm up onto this. The hand stays on the table, and all we have to do is lean forward. You're just going to lean forward until you feel a light pull. And you can hold for 15 to 30 seconds, and then come back. Very simple, easy exercises to start with mobility to the shoulder after surgery. So this is in shoulder flexion. Another way that we can do this, I'm going to turn my chair and I'm going to show you in this position here. So now the table's to the side of me and I've switched arms just so that I can demonstrate. And in this one, same thing. We're going to bring the arm up onto the table with the assistance of the other hand, and we're going to bring this forward just a little bit. So it's not, the elbow's not perfectly in line with the shoulder. It's actually going to be in front of it, and I'll show you why. This one, we're going to stretch the front of the shoulder. So as we lean forward, we're getting stretching occurring here in the front of the shoulder. And that's what we want. If I left my arm back here as I went forward, I'm not getting the stretch that I'm looking for. So it's important that the elbow starts in front of the body so that as I lean forward, I'm getting a pull to the front. I also might need to scoot away, or for this, I'll push this away just a little, so that as I go down, I'm really opening up the front part of the shoulder. Some individuals, as they go down, they have to lean away a little bit too. Some of them are really restricted, so they can only get to here, and they can't feel the stretch that they need to, so you might have to turn the body away a little bit, and then you'll feel it. So that's the second exercise that you could do to start initiating a little bit of mobility and movement to your shoulder after shoulder surgery. So here's the third way. Third way is a simple pendulum exercise. So this is where my arm's dangling, and I'm going to move my body side to side. So I'm moving side, 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 side. And as a consequence, my arm dangles like the trunk of an elephant. That's what I want. What I don't want is for my body to stay still and move my arm back and forth. What's occurring now is the muscles of the rotator cuff are having to fire to suck that into the joint and create some movement. So you're going to get sharp pain and you're going to tell me you don't like that exercise. That's because it's not done properly like so. The arm just dangles, which should be pain-free, and now I shift, 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 and when I start shifting quick enough in that change of direction, is going to create this dangly effect. So overall team, 3 exercises that you can do that will start helping initiate movement after shoulder surgery. Again, none of these should be sharp pain, should be just a dull ache with your stretch, but I do hope that they get your shoulder mobility going, and I do hope that you're able to do these successfully without any sharp pain. If you have any questions, feel free to drop a comment in the bottom of this video, or you can directly reach out to me, either one, and hit the little subscribe button for me as well so that you can continue to get other awesome videos just like this. All right, team, thanks for watching, and I hope you keep moving.